I refused to give my newborn's medical records to my cousin. My cousin Laura showed up at my apartment about 10 days after I gave birth to my son, Milo. I was still in survival mode, sleeping in 90-minute chunks, forgetting to eat, crying over absolutely nothing. My husband was back at work already, pulling overtime because my maternity leave was unpaid, so most days it was just me and a very loud, very angry newborn. When Laura knocked, I almost didn't answer, but she came in smiling, arms full of folders, acting like she was here on official business. She told me she wanted to help organize things because new parents are always overwhelmed. She said she'd been through it with her own kids and knew how confusing all the systems could be. At first, I was grateful. She talked about pediatrician schedules, vaccination timelines, insurance forms, daycare waitlists. She sounded confident, like she knew exactly what she was doing, and my brain was too fried to question it. Then she asked for Milo's hospital discharge paperwork. She said she needed it to coordinate services and make sure everything was filed correctly. I hesitated and asked what services she meant. She said early intervention programs, just in case, and something about getting him registered properly in state systems. I told her I'd already sent everything to our pediatrician and insurance. She waved it off and said doctors miss things all the time. When I told her I'd rather keep the documents myself, her tone shifted. She got more intense, started talking faster, saying delays could affect Milo's care, and that I didn't want to mess this up as a first-time mom. Then she asked specifically for copies of his birth certificate and hospital ID number. That's when my stomach dropped. I asked why she needed official documents instead of just names and dates. She said systems require verification, and that she'd already started paperwork online. When I asked to see it, she said her phone battery was dying. When I offered to plug it in, she said the site logs you out automatically. Every answer felt slippery. I told her no. Calmly at first, I said I appreciated the concern, but I wasn't comfortable handing over my newborn's documents. Laura got offended immediately. She said I was being controlling and dramatic, that she was just trying to help, and I was acting like she was some kind of criminal. She even said hormones were probably making me overly suspicious. She stood up, gathered her folders, and said fine. If I didn't want help, I'd have to deal with the consequences when things fell through the cracks. Then she left. I felt awful for about an hour. I replayed the conversation while Milo slept on my chest, wondering if I'd overreacted. Laura was family. She'd always been the organized one, but when my husband got home and I told him everything, he immediately said it sounded wrong, really wrong. The next day, he called the hospital to ask if anyone besides us could request records. They said absolutely not. He called the state health office Laura had mentioned. They said no such program existed. That's when the pit in my stomach turned into full panic. We started asking around quietly. I called my aunt. My husband called Laura's sister. Piece by piece, the story came together. Laura had been collecting personal documents from relatives for months. Birth certificates, medical IDs, insurance numbers, under the guise of helping. She'd been using them to file fake assistance claims, apply for benefits, and even submit fraudulent medical reimbursements. When confronted, she denied everything until someone mentioned police. Then she disappeared for 2 days. Eventually, authorities got involved. Turns out she'd been investigated already. Thousands of dollars in fraud, multiple victims, mostly family. The officer we spoke to said newborns were especially vulnerable because their records are clean and rarely monitored. If I'd handed over those documents, Milo could have had a financial mess attached to his name before he ever learned to walk. Laura was arrested a month later. I still think about how close I came to saying yes just because I was tired and didn't want conflict. Now I triple check everything. I lock documents away. I don't apologize for being cautious. And when people tell me I'm being paranoid